My name is Dr. Christopher Dubuque. I'm a DO, internal medicine, and I'm also certified in lifestyle medicine.
Hi, my name is Dr. Paul Morton. I'm an orthopedic surgeon, and my primary focus is on hip and knee replacements. So one of the issues with hip and knee replacements is that patients with a higher BMI or higher weight, they're at higher risk of complications. And so one of the conversations I have with my patients is that it's really important that we get their weight into an optimal point as best as possible before surgery, A, for their overall health, but B, in order to improve their outcome surgically.
Hands down, the 7 most common things I deal with: heart disease, high cholesterol, obesity, diabetes is a major one, high blood pressure, gout, or high uric acid. They're all diet-based, diet-related disorders, unfortunately.
So before working with Dr. Jody, I actually sent a lot of patients to the bariatric surgery clinics for a consultation. I do think that if you can send somebody to a weight loss clinic where their primary focus is non-operative ways of helping people lose weight, especially through diet, and they're able to successfully help many people do that in a healthy way, I think that's a good first start, and that's what's changed my practice.
Every other diet goes by the premise of calorie restriction. We don't go by calorie restriction, we go by carb restriction. My name is Dr. Jody, and I am the keto doctor in Hawaii. I own the keto prescription clinic in Kailua. So I think conventional medicine is you go to the doctor, they run your labs, they look at you real quick, they put you on a medication. And every time you go, you're getting put on another medication. Well, that's not really my MO. What I do is I really try to help you and get to the source of the problem so we can reverse your medical conditions and get you off medications, and that's really appealing to a lot of people.
You know, I had heard about her from somebody, one of my medical assistants, and I just said, hey, look, I'll just send over one of my patients to see what happens. I started getting a lot of really positive feedback from my patients.
75% of the people who I refer to Dr. Jody's clinic end up with a success story. Having their blood pressure be under control, having their cholesterol and their labs actually look good, not having to take insulin, not having to take metformin or other anti-diabetic medicines. So there's so many success stories that I've lost count.
So I get patients who I've sent over and they've lost enough weight that they are now candidates for surgery, or that their pain has gone down because they've lost enough weight. I've noticed that a lot of times they feel more energized, they seem healthier, more active.
The 25% that haven't had success, usually it's because they have some internal resistance to good behaviors with their diet, or there was a limitation in their health that wouldn't allow them to use the keto diet, which is why I like to refer to Dr. Jody, because she properly isolates and identifies the people who are at risk of having a health problem from the diet.
Keto is a combination of proteins, veggies, healthy fats. But knowing how much of each category to eat based on your genetics, your medical conditions, the medications you're on, that's where all of this tailoring comes in to each individual patient, which is what I do. Okay, teaching people what to eat is the easiest part of my job. Tailoring that to the individual person is where the whole art of medicine comes into what I do.
I've sent people who've tried keto before, but a lot of times when people who've tried keto in the past, they usually describe some program that they may have read online or prescribed to.
There are risks to doing keto on your own. There are risks on going online, going onto a blog, looking up a self-help guide on keto diet.
There's a lot more to picking your food choices than just looking on a label, and if it says healthy, then it's okay to buy. Or if it says keto, then it's definitely falls under the keto, a healthy keto diet.
If you just jump into it on day one and you start to only eat protein and only eat fat, but your diet was all consisting of carbs beforehand, you could have electrolyte issues, you could have arrhythmias, you could have problems that are really serious Many people have side effects right off the bat. Keto brain, keto fog, muscle cramps, dehydration. What I think Dr. Jody's clinic does is have someone who can meet you where you are in your walk, your metabolism, your weight, your diet, current diet, and then assessing where you need to be in the keto process.
This is an entirely different approach. It has huge medical backing. There are thousands of papers written on this in numerous disease states. People just have to be ready to give it a try and trust in our program, and they see results. If they do what we teach, they all see results.
Working with Dr. Jody has really given me comfort in knowing that I'm sending my patients to somebody who knows what they're doing, a professional, and can achieve good results with significant weight loss in patients who are really struggling.
It's been rewarding for me and my patients. That's why I choose Dr. Jody. It's been a win-win ever since I met her.
She's made a big difference in the lives of my patients.